Welcome and sincere thanks to our partners in this important campaign, Jaspreet Gill, the Executive Director of the York Region Center for Community Safety, or YRCCS, and Simone Spiegel, Communications Director for 482 Collective. We're all working together in an ongoing initiative called Access to Justice, Integrated Services for Survivors of Intimate Partner Violence, with the underlying theme of recognize, report, and prevent it. The overall goal is to increase public awareness and encourage survivors to report physical, sexual, or emotional abuse, and to spark conversations around changing societal attitudes about intimate partner violence. And this initiative has several aspects to it, which Superintendent Corsi will speak to shortly. But obviously, the awareness campaign on the York Region transit buses and billboards region-wide is an important public element. And we wanted to give the opportunity through your coverage a close-up look at the ads, which were generously funded by the Ministry of the Solicitor General. The hope is that the ads will help us as we continue to work towards raising awareness about this important issue and crime. Intimate partner violence affects every community across every culture and societal boundary. The Government of Canada, the Region of York, and various municipal governments have characterized intimate partner violence as an epidemic. More than 60% of Canadians know a woman or girl who has experienced physical, sexual, or emotional abuse by her partner. One in four women experience intimate partner violence before they turn 50. The YRCCS will address its numbers shortly, but they serve more than 500 individuals each and every year. We know the risk of violence is higher for women who are Indigenous, racialized, or newcomers to Canada. And we know that this crime is chronically underreported. York Regional Police is committed to making a difference in this area. We have embedded an officer at YRCCS so that survivors don't have to attend a police station to report an incident, and to ensure that the interaction between our officers and survivors is as supportive and as positive as it can be. And we really want to avoid re-traumatizing victims by having them repeat their stories over and over again. YRCCS then connects the individuals to needed supports and creates seamless transition between these services. Survivors are able to access culturally responsive services in an environment where service providers build relationships and support networks that lead to trust. The 482 Collective provides essential items such as food and personal hygiene products to survivors, and offers wraparound services and skills as survivors move forward. With this coordination and collaboration, we hope the Access to Justice initiative results in increasing the numbers of survivors reporting, with corresponding numbers of survivors successfully referred to appropriate services. They can access those services in one central and convenient location. Once again, thank you to our community partners and to the media here today. With your help, we hope this message will bring or begin to change lives and ensure the safety and security of any woman and girl caught in the cycle of violence. We are all here to help. I'll turn it over now to Superintendent Corsi, who will outline the other elements of this Access to Justice initiative. Thank you.
As Deputy Almeida mentioned, Access to Justice, Integrated Services for Survivors of Intimate Partner Violence, is an initiative meant to empower survivors through education, awareness, and prevention. With the theme of Recognize, Report, and Prevent It, the 3-month bus and billboard campaign is intended to educate the public about the prevalence of abuse and intimate partner violence. Most importantly, alert survivors to the options and resources that are available to them. Our enhanced collaboration and coordination with the York Region Centre for Community Safety, also known as YRCCS, and the 482 Collective is meant to increase the number of survivors able to access the appropriate supports and resources that are largely available under one roof at YROCS. Deputy Almeida referenced some very troubling statistics. Here are a few more that are equally alarming. In York Region, police respond to more than 6,000 reports related to intimate partner violence each year. Criminal charges are laid in more than 2,000 of those incidents. We know the risk of violence is higher for women who are Indigenous, racialized, or newcomers to Canada. And we know this is a crime that is chronically underreported. This has to change. We are hopeful that our activities under the Access to Justice campaign will help move us closer to that goal. This awareness campaign has several elements that York Regional Police and our community partners are proud to champion. November was Intimate Partner Violence Awareness Month. We raised the purple ribbon flag on November 1st to pay tribute to survivors and create awareness concerning this pervasive issue within our community. Along with our community partners, we joined Yellow Brick House as they raised the Wrapped in Courage flag during the annual Break the Silence Step in My Shoes walk on November 5th. On November 14th, we were pleased to partner with YRCCS in hosting the Training Institute on Strangulation Prevention, which provided vital education to more than 150 attendees from 34 agencies, including law enforcement, prosecutors and justice personnel, first responders, health providers, the Chief Coroner's Office, victim services, and social service workers. Strangulation or choking is one of the most lethal forms of intimate partner violence. It can have lasting effects on victims and can result in unconsciousness and even death. It's important that all agencies who respond to and support survivors are trained in responding to this very real threat. The International Day for the Elimination of Violence Against Women was November 25th. And that began the 16 days of activism against gender-based violence, which ends on December 10th. To commemorate the 16 days of activism, York Regional Police members from frontline patrol and investigative units, including Intimate Partner Violence Unit, Crimes Against Children and Sexual Assault Unit, the Human Trafficking Unit, and Homicide, are wearing the purple ribbon pin. This all leads up to marking a day that Canadians remember very well. December 6th is the anniversary of the Montreal Massacre, which resulted in the National Day of Remembrance and Action on Violence Against Women. On that day, we honor the memory of the 14 women who were killed at École Polytechnique in 1989. Our participation in all these initiatives is meant to further educate our community. As you can see, the bus campaign includes a number to connect victims and survivors to the York Region Centre for Community Safety. We hope this will be included in your coverage. Thank you once again for your attendance here today, and we'd like to thank York Region Transit for participating in this initiative. Together, our message to victims and survivors is recognize, report, and prevent it. Thank you.
Good afternoon. The World Health Organization decreed that violence against women, in particular intimate partner violence, is a major public health problem and a violation of women's human rights. Intimate partner violence is an epidemic. It is so pervasive that 1 in 3 women throughout the world will experience physical and/or sexual violence by a partner. We can no longer distance ourselves from this reality. In 2022, YROCS served 550 adult survivors and 789 of their children. We know that there are survivors out there in particular survivors with intersectional identities who are in need of wraparound holistic supports. In conjunction with our community partners, York Regional Police and 482 Collective, we are emphasizing the importance of public awareness of intimate partner violence. Survivors need to know that there are resources available to them. The YRCCS toll-free number will have extended hours, 7 days a week, during this bus campaign, thanks to the support of the Regional Municipality of York that declared IPV an epidemic in September. In order to address IPV, a collaborative response was created more than 10 years ago and was led by York Regional Police. This was YRCCS's inception. YRCCS is a co-located, multi-agency, multidisciplinary service with coordinated service delivery. In essence, we are a hub, providing wraparound holistic supports to survivors, frontline workers from our partner agencies like YRP, Children's Aid Society, shelters, come on site and collaborate with YRCCS workers to better support survivors. We are, in fact, the first international affiliate of the United States Family Justice Center Alliance, a model that brings together social services and the justice sector under one roof to better serve survivors. The key piece that we address is we remove the burden of survivors having to repeat their story every time they access a new service. Survivors have indicated over the years they want to access multiple services in one location. For a vast region like York, it is imperative to have a collaborative response like YRCCS in place, which is why I hope that YRCCS can receive core funding to be able to continue to deliver our essential services. There continues to be a perception that IPV is a woman's issue. The fact is that the implications of IPV extend beyond a survivor and child witnesses to the violence. It is very much a community issue. There is a correlation between perpetrators of IPV and mass shootings. We saw a tragic and horrifying example of this most recently in October in Sault Ste. Marie. This connection was also highlighted by the Mass Casualty Commission regarding the Nova Scotia mass shooting in April of 2020, which had its roots in intimate partner violence. It is not just women who are at risk, but children and the larger community. All of us need to come together as a community to address IPV, and the media has a key role to play when covering IPV. How media covers IPV can have important implications for public policy responses to IPV. Media can shape how IPV is perceived and consequently addressed. The urgency of addressing IPV has been underscored by the 216 recommendations made by the Renfrew County Inquest and the Mass Casualty Commission. All of us are needed to make an impact and help prevent IPV. Thank you.
Thank you. That was the Executive Director of the York Region Centre for Community Safety, Jaspreet Gill. I'd now like to introduce the Communications Director of 482 Collective, Simone Spiegel.
The 482 Collective supports women and children who are struggling to make ends meet after fleeing intimate partner violence, human trafficking, and other forms of trauma and abuse. We deliver essential items to our clients at no charge to them, including healthy, non-perishable food items, cleaning supplies, personal hygiene products, and kitchen and home essentials, as well as helpful items for new moms and pregnant moms. We accept referrals from crisis workers and community organizations like YRCCS, and our highly responsive intake process allows us to give people what they need and not what we think they need. To that end, we will ask our clients, do you prefer white rice or brown rice? Do you prefer tampons or pads, with wings or without? We're very, very specific about what we offer them, and if we're giving them pasta, we will ask if they have a pot or if they have a strainer, and if they don't have those things, we'll add those to the delivery. Our goal is always to deliver and provide our services thoughtfully in a way that preserves the dignity of those in need. As a collective, we value collaborative relationships with community partners who share our values, especially this partnership with the YRP and YRCCS. We recognize that all of our organizations, each one of our organizations, has our own strengths, and when we work together, we can provide meaningful and equitable access to the services and supports that we provide to vulnerable people in the community. Thank you.